Hey, Renee, just want to make sure you can hear me.
I can hear you. Hi, Julie.
Perfect. Thanks.
Okay, Renee, it is 4:30. I'd like to call this meeting to order. If you could do the roll call for us, please.
Sure. Please state present after your name is called. Representing Adams County on the Board of Health, excuse me, Julie Mullica. Julie Mullica. I see you're here,
Present.
Julie.
Sorry about that. I hit the video button and it's supposed to be the unmute button. I got this. We're good.
Rosanna Reyes. And Rosanna, I can see that you're here. See, Julie Shills.
Present.
Representing Arapahoe County on the Board of Health, Jan Brainerd. Dr. Thomas Baywell.
Present.
And Dr. Kaya Gallagher.
Present.
Tri-County Health Department Leadership, Michelle Askenazi, Director of Emergency Preparedness Response and Communicable Disease Surveillance.
Present.
Heather Baumgartner, Director of Community Health Promotion.
Present.
Lisa Bolstad, Administrative Assistant.
Present.
Jill Bonchinsky, Director of Nutrition.
Present.
And I'm Renee Brockman, Executive Assistant. Monique Didier, Director of Administration and Finance.
Present.
Dr. John Douglas, Executive Director.
Present.
Maine Furman, Director of Human Resources.
Present.
Penny Grandy, Director of Nursing. And I believe Melissa Spencer is here for Penny Grandy. Brian Halavasek, Director of, thanks, Melissa. Brian Halavasek, Director of Environmental Health. Jennifer Ludwig, Deputy Director.
Present.
And Dr. Kelly Weidenbach, Director of Planning and Information Management.
Thank you. I see our attorney Sid Overton is with us as well. Welcome, Sid. Did the Tri-County Health Department team want to introduce anyone else that we haven't identified? Okay, we have 3 action items for tonight. Thank you all for taking your time during this holiday week. Just as a short reminder, please use the chat function to raise your hand if you'd like to ask a question or make a comment. For the members of the public who are attending, we encourage anyone with questions or would like to make a statement to use the question and answer function. We compile all of those comments at the end of every meeting and share them with the Board of Health. And after the meeting is over, if you still have questions or comments, I would encourage you to go to the Tri-County Health Department website where there are contact numbers for Tri-County staff if you have some questions you would like to have answered. So our first action item for tonight is to vote on a resolution to use the Tri-County Health Department fund balance for an employee retention bonus. Jennifer, can you provide us some background, please, on this request?
Yes, thank you, Kaya. Mame and I are going to be sharing in this presentation, and Monique is here and can answer more questions specific to the fund balance and our calculations. And Lisa is pulling that up. Thank you, Lisa. So go ahead and go on to the next slide. Over the last few weeks, you'll probably recall we have been sharing our concerns about turnover that we've experienced in 2021 and most recently in this last quarter of the year. We have shared that with you as the Board of Health in previous meetings, as well as our Board of County Commissioner liaisons and with the boards of county commissioners and our counterparts at the counties. The reason we've been sharing this as an initial concern was transparency and also to let them know that we do have concerns about our ability to provide services if this trend continues. So tonight, and part of the reason for this special session is to share with you that complete picture of employee turnover. We have taken the last couple of weeks to pull all together the data, the information, what we have, what we know, and have put together a package that we believe will really help with retention. So first, we'll share that complete picture of the employee turnover, discuss our concerns about service provision now and into next year. And then we do have a comprehensive retention plan. We won't go into every detail about that, but we do want to present the fiscal impacts of certain retention strategies that we hope to employ at the beginning of 2022, which leads into our request for approval for additional spending authority in 2022. And the reason why, part of why we're asking that now and why we didn't ask when we brought you all together for the annual budget or the adoption of the 2022 budget, we had anticipated that we might need to employ some retention strategies next year, but we didn't realize, or we hadn't put it together, that we really need to get that started and be effective January 1. Because of the turnover, we did not have that ready to go in the 2022 budget ask, which is why we're asking for that additional spending authority. So this is really more for the benefit of anybody who may have been reading our material on our website or joining us as members of the public. To remind us all and to take a moment to appreciate all of the things that Tri-County Health Department does and what we do as a public health agency. I think COVID, especially really in the last several months and maybe all of this year, has really overshadowed everything else that we do. And we are a lot more than just mask mandates, that we provide services still for Adams, Arapahoe, and Douglas counties. We are still the public health agency for Adams and Arapahoe counties. We are serving Douglas County through an intergovernmental agreement through the end of next year. We provide over 60 different programs and services throughout the jurisdiction from 11 different facilities. We have close to 390 employees. And some of the programs and services that we do that people don't even think about or don't even know that they are benefiting from every single day include things like, but this is certainly not an exhaustive list of everything that we do, but birth and death certificates, immunizations, just our regular childhood immunizations, everything from COVID to MMR, disease prevention and control, and that runs the gamut from salmonella, other foodborne illness outbreaks, as well as obviously COVID. Emergency preparedness and response. And this is more than just COVID. This is wildfires, active shooters, all types of events. Our team responds as the medical emergency service function. Restaurant inspections. I think most people do appreciate and know, but I think we take for granted when we go in to a restaurant and eat, or into a grocery store and we're shopping, taking for granted that is a core function of public health, as well as childcare inspections. That is critically important to families in our communities. And policy. I think we've kind of forgotten all the work that went into smoke-free policies back in the day. We're continuing to work on smoke-free, vape-free policy, tobacco policies. But most importantly is our 390 employees. They are the heart of this agency and the heart of our communities and our partnerships. And it is absolutely critical that we maintain their expertise and their service. Next slide. So I'm going to turn this over to Mame. The next few slides, Mame is going to talk through the situation with turnover and provide to you hopefully a clear picture of what we're dealing with and what we're understanding of our employees.
Thank you, Jennifer. Happy holidays, everyone. So just like many organizations, we're experiencing the great resignation or the turnover tsunami. We have employees leaving for pay, promotions, and to be closer to family. Those are the top three we're seeing, and so those are the top three the nation's seeing. Unfortunately, though, we have an extra issue, the uncertainty of Tri-County. And that has really played into higher turnover than we've had for forever, as far as I'm concerned. We want to do everything possible to retain our highly qualified, experienced employees that serve our communities. So the current situation is we have, out of 390 employees, that number, actually 84 employees have resigned. That's no longer valid. And since we sent out this PowerPoint, we became aware of 5 more resignations. So that's 89 employees have resigned in 2021. So that is 36 more resignations than in 2020 and 24 more resignations than in 2019. And this fourth quarter, I'm so hesitant to open my email these days because every day, and including today, I see another resignation. It's the highest number that we've ever had in the fourth quarter of resignations. And it's at 34 right now. And we've also had a lot of retirements this year. 13 retirements. Last year we had 1. The year before we had 3. 2019 we had 3. And I'm sure from talking to the retirees that the uncertainty and the burnout, mainly from COVID, led to their decision to retire. I know that personally because I had somebody in HR retire. Higher pay, promotional opportunities, and relocations, those are our top reasons for employees leaving in 2021. Those were also the top reasons in 2020 and 2019. However, the number is much higher in 2021. Most of our employees stated Tri-County's future was a factor in looking for another position. And we have added that to our exit interviews, and that is certainly showing as we speak to employees that are leaving in this fourth quarter. Next slide, please. Thank you. The turnover by numbers tells the story that the 3 largest divisions, nursing, nutrition, environmental health, are having the highest number of employees leaving. Next slide, please. But here's a different story. This shows percentage of turnover by division. And this is showing that some of our smaller programs like emergency preparedness, response, and communicable disease surveillance, say that 10 times fast, but anyway, they're one of our smaller divisions, and they don't have the numbers to absorb the turnover that we're seeing in those smaller divisions. That's true of PIM, Planning, Information, and Management, and the executive division is mainly our communications staff. We've had high turnover, and again, it's been very challenging to absorb those duties while we're trying to refill the positions. Next slide, please. So this is another view. This is jobs with the highest turnover. All of these positions take time and lots of effort to get employees up to productivity, to understand the mission and vision of public health, and to really be able to service our communities at the level of the employees that left. Next slide, please. So what does this mean? Impact to services. Jennifer's going to go over this a little bit more in the next slide, but disruption of services. And most important, employee workload increases until replacements are up to productivity, and it's kind of almost a vicious cycle. Employees then get burned out. They get burned out from training employees continuously. We've heard this quite a lot this year, and we're looking at ways to systemize some of the training, but it's still causing extra workload and extra burnout of our current employees. And then another huge impact is loss of institutional knowledge, the history, why we do things, how we do things. We're losing that, it's going out the door. And then the cost of replacing employees. You hear from SHRM, which is Society of Human Resource Management, 2 times salary. And that's a nationwide number. And that is really for the professional level. But even the lower level of employees can cost 60% to 1% of their salary to replace. And that cost is significant when you're looking at 85 employees. Next slide. Jennifer?
So there's implications to the programs and the staff themselves and taking on that extra burden, but there's absolutely an implication to providing that service in the community and the expectations of us to provide that service in the community. And we are concerned that this trend, if it continues and we struggle to fill positions, because we speculate, this is part speculation, but the longer that we go without certainty, the harder it may be to fill positions. But in the meantime, we're still, staff are filling and pulling double duty and training new people all the same time. Our concern is if that trend were to consider, if we don't course correct or reverse it, we may see a reduction in services and our ability to fulfill our expectations to our community, to our clients, as well as internal functions will suffer. Some examples of services that have already seen an impact and have already made some adjustments. Our sexual health clinics are reducing to 4 days a week as opposed to Monday through Friday. Environmental health has recently moved to a risk-based approach for responding to complaints and inspections. So this is kind of a triaging. They'll respond to emergent, urgent needs and have to prioritize their when they go out and respond to complaints. We're noticing there's a limited resilience to respond to the COVID-19 surges. And this is Maine talked about burnout, and it's real all over, and we're definitely experiencing it within our organization. And WIC is experiencing delays in scheduling, and there are longer wait times, there's wait lists, and it is harder for the WIC program to schedule clients in the same day, same week, which is their goal. So we are already starting to experience some of the impacts due to shortages. Next slide. But we also acknowledge our responsibility to our staff and the communities we serve to do everything that we can to retain our exemplary employees and to provide our best-in-class services. So our response, there's 2 parts to this that I'll talk through a little bit. Our transition planning effort, which has been ongoing and it's really picked up in the last couple of months to couple of weeks. We've really gotten a little bit more aggressive in our planning efforts. And then our employee retention planning. So first, our transition planning effort, been providing updates via email, but as you are aware and know, you've met our consultants with the Ottawa group, we are transitioning into we're calling phase 2, the transition. And they are working separate scope of work with Arapahoe County, working very closely with us in moving forward and looking at what will we build moving forward. Change Matrix is a group as part of the Ottawa group contract. They will be coming in and working specifically with our staff next month into February and March on change management. So really helping prepare our for change. We've already experienced change with Douglas County leaving and providing services via an agreement. And we continue to experience change. So they will be coming in and working with our staff and doing small group sessions with them and really kind of preparing all of us and helping all of us through this change. Ground Floor Media is a PR firm that we have recently brought on board, and they have been fantastic in really thinking through messaging and getting out in front of this and really thinking about who we are and our brand and helping out with that reputation. And legal expertise, we are exploring additional legal capacity and bringing on some expertise in some very specific areas that we need to just build up our force around. And then, so that's our transition effort. Then the other responsibility that we have and that to our staff and our communities is this retention planning. It's really critical that we retain, as I said, our employees and that expertise. We have incredible expertise and exemplary employees, and we need to keep them. We do have an internal work group that has been meeting regularly, brainstorming ideas, going back to their staff, getting more input and ideas, and have come up with both non-monetary and monetary strategies. Next slide. So Mame and I are going to talk briefly about non-monetary and the financial incentives, but I'll share with you, we kind of put these into 3 different categories for our full retention plan. So non-monetary strategies, Mame will talk about a market survey. This is something that HR does annually. We will be doing this sooner than later, this in 2022. In fact, I think Mame has already gotten a head start on this to look at where we may need to make adjustments to be more competitive in the marketplace. And then I will close out, or Mame and I will share responsibility in talking about the financial incentives, which is the bulk of our proposal and request for tonight. Next slide. Mame.
Okay, thank you. So well, first I'd like to say it's very clear from what we've heard from employees that the best strategy to get employees to stay, even over compensation, is a clear vision of the future of Tri-County and where they fit into it. And we can't give them that just yet. We will be able to, but we can't just yet. So these strategies are in the works to really supplement that. The first thing is the stay interviews. We're currently in the process of doing our performance evaluations, and we've added to those evaluations to be more of a discussion and talk to employees about what gets you excited about working here, what are your career goals, and how can we achieve them? Just to kind of get a feel for if employees are doing okay or if they're thinking about leaving and what we can do about it. We've had several para informational meetings, and we're going to be sending out some total compensation and benefit reminders in January. We have some great benefits that are more than just your salary. So we're going to make sure employees are aware of that. Enhanced communication and transparency. We really need to make it clear to employees what is in it for them to stay. Why should they stay? And additional health and wellness offerings, including financial wellness program that we're going to roll out in January. Other things like workload assessments, skill assessments, coaching and opportunities to upgrade skills. We want to make sure we're setting employees up for success now and for the future. So we want to help them build their resumes, and hopefully we will be using those skills here at Tri-County. And most important is employee engagement in building the future of Tri-County. They need to be part of the conversation, and employees need to be part of the solution, and we're going to make sure they are. Next slide. So let's go back to the monetary solutions. We're proposing an immediate by moving our annual salary increase from 4% to 5%. 4% was already approved, but when it was budgeted months ago. We didn't know at the time, though, how competitive the market had really become, especially in our sector. And unfortunately, we learned that the hard way by having our employees offered jobs at the same jobs at a higher pay rate than what we were paying. We also, as Jennifer said, I've already started doing a lot of the market reviews. We actually do a full market review every 2 years, and we've moved that up. now. And as I'm looking at the market, it has moved, and it has moved very fast this year. So we only did a small COLA last year. We didn't do an annual increase. That put us even further behind in the market, unfortunately. The cost to go from 4% to 5%, January 1st, that's when our annual increase takes place, is only $280,000. And it's something that we can do immediately, knowing that we're still going to look at the market and make sure everything is competitive and where it needs to be. But we already know we are below the market at least by 1%, but I'm confident that it's even more than that. But we will get the data and make sure that we're competitive in all the different jobs. Next slide. Jennifer?
Thank you. So this is the bulk of the request. We've talked a lot at the executive level about a retention bonus. So this is something that Tri-County has never done, but there are a lot of, the private sector and the healthcare sector do a lot of sign-on bonuses and retention bonuses for certain positions. We are requesting a financial incentive for employees to stay through the end of June of 2022. This is an investment of $5,000 prorated for FTE for employees paid by Tri-County who stay with the agency and remain in good standing for performance for the next 6 months from January 1 to June 30. This bonus will be includable in PARA's highest average salary calculation as an added benefit. So this really matters for employees, especially those who might be getting closer to retirement or who have invested a lot into PARA, having that as added to your highest average salary calculation. And in order to disrupt or to reduce disruption in services and functionality. So this is both our services and programs that are client facing, working with partners, but also the internal operations. We are requesting that this bonus be for employees, all employees who are working over 20 hours per week, which is the vast majority of Tri-County Health Department. We have just a handful of employees who are less than 20 hours per week. Our rationale for this 6 months is that we anticipate that more will be known by the end of the first quarter of the year, and then we can determine if additional strategies will be needed. But we anticipate that we will have a clear direction and we will know more in March, April, and if we need to course correct or if we need to add additional strategies. Either we might be able to find that within the 2022 budget, or we may have to come back to the board to ask for additional funds. But we do feel that most imperative is this retention bonus for this first 6 months, and that we're hopeful that we don't need to extend a retention bonus till the end of next year, because we anticipate knowing more in March. We're hopeful that we'll know more in March that will provide a clear direction and the certainty for our staff that we have been seeking. The cost of the retention bonus for current employees prorated is $2.6 million. Next slide. So fund balance, we do not, Tri-County Health Department does not have much of a history of coming to the Board of Health to ask for additional authorization use of funds for the unassigned fund balance. Our fund balance, these are numbers from 2020. This was audited numbers. These are the numbers that we are using because we don't yet have 2020. We've not closed out 2021 and we don't have those audited numbers. But 4 categories, 3 of which are assigned, so we don't use those funds. Our non-spendable fund balances for inventory and prepaid, that's a total of $858,000. Our committed fund balance, this includes our emergency operating reserves, which we increased, I believe it was 3 or 4 years ago. And then our committed for future employee compensated absences, that equals 11.8 million. And then our assigned fund balance, it has an amount of 1.8 million. That's for facilities, master planning, information technology, and capital replacement. Those are assigned funds. We use those for special projects. Our unassigned fund balance is 11.5 million. Those are operating capital. Next slide. We are proposing to use unassigned fund balance in the amount of 2.8 million to implement our 2022 retention plan. We would move 2.9 out of the operating capital into an assigned fund balance categorized as retention / transition plan so that it is specific to that. The 2.9 includes our retention bonus of 2.6 million plus the 1% salary increase of 280,000. The unassigned fund balance would have a remaining balance of $8.5 million. Next slide. So this might be good to open up to questions before we move into this. This was just suggested language for a motion if the board so chooses.
Okay. Thank you, Jennifer. I see 2 hands up. Dr. Faywell?
Yes, on the salary increase, is there a limit to how much you could increase? You talk about a 1% increase. Would it be possible to do a 2% or a 3% increase so that we got ahead of the market and maybe people would apply to us instead of leaving us to apply elsewhere?
We started out with the 4%, that's in the budget. We felt that moving to 5% was a competitive salary range and something that we could afford, not just in the fund balance, but the programs also. If you're grant funded, fully grant funded, the grant pays for that increase. So moving up to the 5% was even they've already budgeted at 4%. That 1% is going to be covered by the general fund. If we go up more from that, this would be up to the board. The board could decide, but we in looking at the market and looking at MAME's salary surveys, we felt 5% put us in the right range. But I'll turn it over to MAME for you and your team do more of this research.
Well, the only thing I would add is we are in the process of doing a complete market survey for all of the jobs right now. We know we're behind the market at least 1%, probably more. And once we have all the data, then we will know if we need to go higher based on the data and where we want to be in the market. We have to have a discussion. Right now, we're in the average of the market. Maybe we want to be the leader in the market, but what would that cost? So we're not ready with that data yet, but we will be in January. And we may or may not have to ask for additional funds. But in the past, when we've done market surveys, we've been able to use some of the vacancy savings for that adjustments.
Thank you. I see lots of hands up. Please be patient. Dr. Douglas, did you have a comment relative to this discussion?
Yes, I did. I just want to maybe clarify with Dr. Faywell. I mean, I'm assuming the nature of your question, Tom, is that maybe this is a time once MAME completes a market survey for us to be a leader in the market as part of what we're trying to do, both for our current staff as well as future staff. Do I get that right?
Yes, that's what I was getting at. Of course, with the fact that we are going to have new departments in Adams, Arapahoe, and Douglas, that made me make it a little more difficult. But it'd be nice not to always be the tail of the dog. It could be the nose out in front, maybe.
The nose of the dog. Good.
Thank you. Jan?
Oh, thanks, Kaya. First of all, I am glad that we're being proactive about this. I'm really glad that, so many companies have had to go through the same thing to retain or to have enough employees. So I'm glad we're being proactive. I also was thinking along, asking the similar question, that Dr. Faywell asked. I just had two comments. One was a little bit longer. When you were going through all of this, the thing that kept popping in my mind is the fact of the matter is, no matter where we go with this, there's going to probably be reduction in services. And I guess what makes me the saddest of the whole thing is that my background is so related to children. The services for the breastfeeding mothers and to help them navigate parenthood and the stresses, whether they're working or not and trying to raise their children, the mental and physical health services for the children. I mean, these are our future, these kids, and that's an old cliche. But this is what I want people to think about. I know the board and the staff does not think of this, but that's the hardest thing for me, is to see the services that will be reduced by this whole, whatever, the whole situation of where we are now. So that's just my comment. And I would just like to thank the entire employee base of Tri-County for the quality of their work and their dedicatedness. Dedicatedness, that's not a good word.
That's a great word, Jan.
Thanks, Jan. Julie Mullica?
Awesome. Thank you so much. Quick question. How many openings do you guys have currently right now for Tri-County Health Department? Does anybody know?
If we don't count the COVID openings, 17.
Okay, 17 openings. Okay. And so one of the things that, since this does seem to be a really evolving situation, unfortunately, very quickly, I think one of my only asks as a board member is just to make sure that, we're getting regular updates. If it sounds like on a weekly basis now on just, where we're at with staffing and how we anticipate that, affecting services moving forward. I think, as long as we're in the loop of things, that could be really helpful, just trying to anticipate these needs. Another actually point of clarification that I had is, so in one of your slides, you talked about services already being impacted, and you have environmental health has moved to a risk-based approach for responding to complaints and inspections. Can you just give me an example of what that means in real life and like a day-to-day type of scenario, just so I can have a full understanding of that impact?
Sure, I'll do my best. Brian is on a plane right now, so he couldn't join us. I think that's where he is. But I think when we get, when environmental health will get lots of complaints, and they will prioritize something that might be an imminent health hazard. So if somebody is calling on a restaurant that they saw rodents running across the floor, or saw something that seemed like an imminent health hazard, they will prioritize that over, I can't think of what wouldn't be a priority, a complaint that wouldn't matter. I see Dr. Douglas has his hand up, so he probably can explain this better.
Well, I mean, it does get down to things like that, Julie, but I think it has to do with a lot of the routine work. A lot of the routine work on COVID got put on the back burner, and that was terrible. I mean, we did far fewer inspections than we should have. And the team has really been busting gut to kind of get back up to where we should be, and having to prioritize things because we do so many inspections. The most practical outcome is we look at a place, and if it's sort of low risk, they serve hot dogs on a grill versus sushi and a lot of meat in the kitchen, or, they serve 1,000 people a day versus 30 people a day. Those are the kind of decisions that get made. And I mean, we it's like a hospital ER, you triage for the most important stuff, but you were clearly going to be leaving some stuff behind. And I think routine inspections like that maybe are a bigger set of choices than this. This person has a roach and that one has a rat. Which do you respond to? You probably respond to both of those, but it's the routine inspections, I think, that get hit the hardest.
Okay, that's really helpful. Thank you. I really appreciate that explanation. I don't have any other further questions, but overall, I really support this plan. I really support our staff in any way that we could try and incentivize them to stay with us and continue to work with us through this transition. I think is so. Thank you for putting this plan together, everyone who's involved, and yeah, definitely. Just I'm happy that this was able to come forward today.
Thank you, Julie. Julie Schills, you have your hand up.
Yes. Mame, you mentioned, I think that we have 17 open positions right now. And I was just wondering if you can speak to whether we're getting resumes in and able to interview individuals. And the reason why I'm asking the question is the other thing you can do is a sign-on bonus for people and then asking them to stay for a certain amount of time as well. I know you're tackling the biggest group right now with us, but I did just want to mention that as a potential opportunity. And I was also curious, as you go to a 4% and potentially an additional 1%, will that raise then salary potential for those 17 open positions as well?
Thank you, Julie. Yeah, the idea of a hiring bonus has come up. At this point, recruiting is pretty much the same as normal. Our hard to fill jobs are still hard to fill, and the jobs that we get a lot of applicants that are still coming in. But I really anticipate that changing next year as Tri-County figures out what we're doing and people aren't sure if we're even Tri-County anymore and that type of thing. So that's definitely a back pocket situation. I used hiring bonuses in the past for nurses, and they work pretty well if they're large enough. That's a key. And then there was another question in there, Julie. What was the other one?
I think that was the main question. I think you answered both my questions. One, okay, are the open positions, are you getting resumes in? And then 2, was there a consideration of a sign-on bonus?
Yeah, and I also think advertising costs are gonna increase as well next year too. So we are gonna see some recruiting issues like we've never seen before. So I will, I think someone asked to keep updated weekly, Julie Mullica. So definitely I can work with John and Jennifer to start kind of a weekly update to the board on recruiting and retention.
Thank you, Mame. I actually have a question about the timing of this. I'm assuming that this is a 6-month request in part because the Tri-County budget is from July 1st through June 30th. So we're tacking on to this current budget or this year budget. No,
we're asking for the spending authority in 2022 because we didn't have this in the budget that you adopted on December 8th, 9th. So it's in addition to what you approved for our annual budget. Our annual budget is the calendar year, January 1 to December 31. 6 is because we are hopeful we don't need any more retention strategies from July to December. If we do, we may have to come back or we may have to adjust some things in our FY22 budget.
And actually, I was just going to ask, because you did mention that there could be additional strategies. So, Mame, if you get the survey results, let's just put into context that inflation is actually more than 5% at this point. So you get the salary results back, the survey, or you get some the market information. Do you anticipate that this 6-month window is enough, or do you believe that you might actually have to come back to the board sooner?
Well, I think when we do a market survey, we find 3 different matches. We decide where we want to be in the market. So there may be jobs that are lagging in the market. There may be jobs that are correct. And I do anticipate that we will see some salary increases in some jobs so that we are higher in the market. What they are yet, I don't know, but I'm going to quickly find out in January. I have a consultant helping me. It depends if we have some vacancy savings or if it's not an egregious amount of money, we may not have to come back to the board. That's Jennifer's area, not mine or Monique's, but we may have to come back.
Okay, great. So it sounds like that what this proposal is an interim approach to where we are at the current time, recognizing that we may have to revisit this question sooner than June 2022. Okay.
We had anticipated once we go through our initial the process with Arapahoe County and looking at, their timeline is to hopefully have a clearer direction in their direction, and we are hoping to have a clearer direction. We're aiming for the first quarter of the year. We will know better by then what the second half of the year will look like, and so we may be coming back. We'll provide regular updates, but if needed, we probably were looking at the month of April or May if we need to come back for additional funds. At the same time, there are projects planned in 2022, and part of the budget that you adopted has some large projects that we may reevaluate, and those are funds that we may be able to use and redirect to retention strategies if need be, which is why we didn't want to go for a full year in this request, is we may be able to adjust our budget, our FY22 budget within its means.
Great, thank you, Dr. Douglas.
Yeah, I just want to say, I think the next 3 months are really the most critical. Now, the counties, certainly Arapahoe County has implied they hope to have some sort of plan gelled by the end of the first quarter. And as Mame said at the beginning, the biggest problem is the uncertainty. And if we can really get gelled uncertainty or certainty gelled by the end of the first quarter, that will be hugely important. But we're going to follow these stats weekly. And if we start seeing a crescendo, we're going to be back before April. I mean, honestly, we might be back in January. This is an incredibly fluid situation. And sometimes the messaging ends up being confounding, and then it sort of it creates more concern and uncertainty for our staff. So I just want to say that I think Mame and Jennifer have done a fantastic job, and I want to emphasize every member of the EMT has been roll up their sleeves, incredibly engaged in helping us think about what to do about this. I cannot say enough appreciative things about their leadership during this time, but we're going to be tracking on this incredibly closely. And I'm hoping the plan they've laid out is going to be successful, but we're not going to just assume it's successful. We're going to watch it really closely.
Great, thank you. Jan?
I would just like to say, I hope the counties are really looking at what you're saying, because if they're contracting with us, we need the employees to provide the services for them.
Well, this is the huge message, Jan, and we have been promoting that, and I know that our board has been promoting that in those opportunities that you have, and I think all of us being on the same song sheet about this, I think will be really important. So thank you for that comment.
Great, thank you. I don't see any more questions. No more hands raised. At this point, can I have a motion to approve this resolution to use the Tri-County Health Department fund balance for an employee retention bonus?
So moved.
Is there a second? All in favor, please say aye.
Aye.
Anybody opposed? The motion carries. Thank you. Thank you to all who prepared that great information. The second action item that we have to approve tonight involves proposed changes to the interim Board of Health bylaws. What I'd like to do is to call for a motion to put the motion on the floor, and then we can have discussion about the proposed bylaws. I know that they've been circulated. This Board of Health members have had a chance to see the actual language that's being proposed. Do I have a motion to approve the proposed changes to the interim bylaws?
So moved.
And I will second it. So now we'll move into discussion. I had added some language to the duties for the co-chairs to say that the co-chair persons will keep all Board of Health members informed and promote communication between the Board of Health and Tri-County Health Department staff. And the co-chairman will also enable all Board of Health members to be actively engaged in any and all decisions related to Board of Health matters. Julie, since you were the person that approved this motion, would you entertain a modification to take out the language about the executive committee? I feel that that's unnecessary since there's 6 of us. We don't really need an executive committee, which would consist of 4 people to make final decisions. If you're okay with that, I am proposing that the first sentence on the 3rd paragraph, which reads, whereas there is unresolved disagreement between co-chair persons regarding a governance issue, the matter shall be referred to an executive committee as selected by the board and consisting of 2 Board of Health members from each county to make the final decision. Are you okay with deleting that sentence?
Yes. And so do we have to clarify? So just delete the whole sentence. And then, so if there are any resolved issues, it would just go to the committee as a whole.
Yeah, to the Board of Health as a whole.
Okay. Yeah,
So,
I support that.
Renee, when you have a chance, if you could delete that sentence for us, please. There any other discussion about this proposed bylaw change? Yes, Julie. Melika.
I'm muted. Okay. The only additional discussion, and maybe it's a point of clarification, is just to clarify that staff will communicate equally among the co-chairs, right? And so that, and I don't know if, I feel like the language in here is really speaking to that point, but I just wanted to clarify that that is the interpretation that at least I'm reading. Co-chairs are equal and therefore staff will communicate to co-chairs equally.
Well, that's the intent. Did you have proposed language that you wanted to include?
You know, I don't. I think I just wanted to clarify that intent, that I wasn't off base or anything like that. And so I'm fine with it as written, just more of a clarification.
Well, it certainly is my intention that would be the case. And we'll just make that work throughout the year. And if there needs to be more communication or better communication, we can always improve, I'm sure. Jan.
I just wanted to ask how this is going to work. Are we discussing everything that will be discussed and then the vote will be taken, or will we have a chance to discuss our concerns or feelings about this? Is it best to do that now?
It's up to you. We are discussing the change in the bylaws, and then the second action item is actually the election of the board officers. And so if this is a broader comment about the bylaw change, I would invite you to make your comment now.
Okay, yeah, that's exactly where I am with that. I would just like to say that I think this is an unnecessary action by the Board of Health. Our purpose is to oversee the operations and activities of Tri-County, whose mission is to promote and protect the lifelong health of individuals in its 2 counties. We have worked effectively as a 9-member board for 3 counties and now 6 members to carry out the governance of this mission. We've always committed to protect principles for the county as a group, not acting in any other way but democratically for decisions for all the counties. Somebody talking? I'm sorry.
Sorry.
Can you hear me?
Yes.
Okay. Yeah, we've always committed to protect these principles for the counties as a group, not acting in any other way but democratically for decisions for all the counties. I do not see the need for changing the bylaws or leadership structure at this time, when the 2 remaining counties in 1 year will be having a governance structure change to represent their own county health department. We did not have the need to have 3 chairpersons when there were 3 counties. Before, when we had 3 counties, the current leadership team of our Board of Health, I feel, has worked together well and effectively this past year during all the difficulties and decisions that had to be met or made. And this leadership team consists of members from both Adams and Arapahoe County. The decisions and policies are not made or influenced by the president or leaders in charge, but rather by the vote on the entire board representing the 2 counties. I have always made my decisions based on what I feel is important and not partisan, but what is best for the health of the people that Tri-County serves. For me, these changes will accomplish nothing that will benefit the operations, mission, and charge of the Board of Health. Keeping the structure for 1 more year with the Board of Health operating as it has until the counties have their own structure and governance is less disruptive. And our efforts should be focused on helping Tri-County continue to operate as the excellent health department as it always been and continues to be, rather than concerning ourselves with changing bylaws, leadership type, etc. And that's what I wanted to say. Thank you for allowing me to speak my opinion.
Thank you. I'd like to take a roll call vote on this vote. And so if anybody has any additional comments, you can make them when you express your vote one way or the other. Dr. Faywell, did you have something before we start a vote?
No, if we're going to comment while we vote or as we vote, that's fine with me.
Okay. Are there any other comments that any Board of Health members would like to make before we begin? Not seeing any. I'll start with Adams County. Julie Mullica, you were the proponent of this. First move the motion, so you can go first.
All right, so I support this motion, and I encourage the rest of the board as well.
Great, thank you. So that's a yes, right? Yes, that's yes. 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 Okay. Julie Shills.
I support this motion as well and vote yes, and appreciate the comments Jan has made. I do think this year is one of the reasons I'm supporting this motion is that there is a reality that there will be a lot of changes. And I think those changes in this response and the change in the bylaws reflect that we do want to continue to work in a bipartisan way and move forward with all of the actions as Board of Health members in support of Tri-County.
Thank you. Rosanna?
Hi. Yes, I vote in support of this motion. I agree with Julie, my two Julies, or the Jules as we call them in Adams County, that this is a very needed move so that we can continue to work and improve our collaboration between these 2 counties in a very important year. And I agree with Julie Schultz. This is very much needed, and I appreciate the work that was put in there. And I do hope that communication is improved and include from both of the co-chairs with the executive director, that they work jointly and not singularly. Thank you.
Thank you. Well, I will vote to support this interim bylaw change. I think it's important that each county have representative leadership, and I do hope that as a board, we can continue to agree on decisions that are in the best interest of Tri-County, and that we support each other as we go through this transition. Jan?
Thank you. I already stated, I'd just like to add to that whatever the decision is, I will continue to work with this board that I enjoy working with with the same integrity that I always have, no matter the vote. And so I vote no.
Okay, thank you, Dr. Faywell.
All of the points that have been made are points that could be made in the present structure. Jennifer mentioned transparency. That's the political and governmental buzzword of the day. And transparency is how I view this co-chair proposal. It's a transparent maneuver by a few to avoid the present bylaws regarding annual voting for the officers of the board. You can put all the communication language you want on top of it, but that's what it is. Faced with the very real possibility that votes won't go in the favor of a specific candidate or candidates, the answer to how to get around that is change the bylaws. Great. Going forward, are we going to change the bylaws every time there's a point of contention in order to appease a few? Legal counsel has told us he doesn't see this type of governance structure in similar organizations and was of the opinion that it's not in the best interests of an organization to have such a structure. For the devotees of NALBO best practices, such practices could be considered for future boards of health, since all 3 counties are going to develop their own health departments. However, they should not and do not outweigh legal opinions regarding unique situations such as ours. You've got to remember the president or the vice president, whoever's running the meetings, has no unilateral powers. They have no veto powers. They have to get the material together, make sure that everything's ready for the meeting to go forward, to run as smoothly as possible, and try to avoid a 4 or 5 hour meeting. If the reason for bylaws change is some cooperative dialogue that increases communication between Board of Health members, that can be accomplished by phone, by email, or in-person conferencing. Well, as long as you have only 2 people, because with 3 you'll violate the open meetings law, which passed by Orwellian legislators who believe all the animals are equal, just some are more equal than others. On the other hand, if enriching one's resume is a reason for the change, why not change the bylaws so that we're all presidents every other meeting? That way, look good on your resume whenever you're going to go for the next Board of Health or whatever political office may be in the near future. I've been told that having co-chairs allows one to advocate for Adams County or advocate for Arapahoe. We have a number of new board members in the last few years who don't have the depth of history of Tri-County Board of Health over the past decade or 2. Prior to 2015, as Jan said, we had a 9-member board that addressed Tri-County public health problems as a whole, regardless of what county was having the issue. One for all for one. No one has been denied the ability to advocate for anything at any time during my tenure on the board, which spans 19 years. This idea that we would possibly have a problem getting an issue in front of the board is just a red herring. The idea that we could possibly have tie votes, another red herring. If you look at when we were a 9-member board, we seldom had a 5-4 vote on anything. It was usually unanimous. Of late, there have been some 7-2, 6-3 votes, with or without abstentions. Now we're a 6-member board. Real possibility of a 3-3 tie. Look at the votes so far. They've been unanimous or 5-1. There might be 4-2 tonight. It's the strength of the proposal, not the person or the county that's submitting the proposal, that gets the votes. Present bylaws state that with the exception of doing what we're doing tonight, changing the bylaws, which requires 2/3 of a vote, the only thing you need is a simple majority of the voting members that make up the quorum to pass a proposal, a resolution, a motion, a public health order. Co-chairing doesn't change this. It's just getting around the fact that the annual election of officers is going to be different because a certain candidate or candidates can't get elected. It's difficult when you have 6 people. I understand that. With this once in a lifetime pandemic, hopefully once in a lifetime, that we face today, for us to be spending time debating changing bylaws for trivial partisan reasons is not what professionals do. This strikes me more of some kind of a junior high school drama with, unfortunately, overlay of politics. Will the fact that it's co-chaired rather than a president and a vice president solve any pressing problem that can't be addressed by the present structure? No, I think the answer is obvious, obviously. We have another tough year ahead of us. Our last year of being a board, or what's left of it, we should focus on the major issues ahead. Why don't we get back to addressing public health and stop this nonsense? My vote will be no. No changes, no wordsmithing, just no. Thank you, Madam President.
Thank you, Dr. Faywell. The motion carries 4-2. I'll just say that I appreciate the commitment of all the Tri-County Board of Health members to our board. And I recognize that we have differences of opinion, but I hope we can work together through this next difficult year and always think about the best interest of Tri-County as we're making our decisions. Our third action item is to approve the election of board officers for 2022. Given the bylaws changes, we have 2 co-chairpersons up for election, and that would be me representing Arapahoe County, Julie Mullica representing Adams County, and then Julie Shills remaining as secretary. Do I have a motion? I'd like to call for a motion in a second, and then we can have discussion. So do I have a motion to approve this slate of officers?
So moved.
So moved.
Okay, can I treat that as a move and a second then? Since there were 2 of you
Sure.
that spoke at the same time. Great. Any discussion before we take a roll call vote? Seeing no hands raised. Julie Mullica, would you like to start?
Yes, so I support the motion. You know, one of the things I'm really excited about with this structure is that, you know, it allows flexibility with this board. We don't know what's coming in 2022. And I think that this allows us to deal with the rough waters ahead and each guide our counties into the transition that best fits our community. So as that moves forward, so I do support the motion. I'm excited to serve.
Great, and thanks. As being nominated to be co-chairperson, I'm committed to making this work. My goal over the past year is to be as transparent and democratic as possible in our decision making, and I'm committed to those same principles as we work through the next year. So I vote yes. But let's go back to Adams County. Julie Shills.
I vote yes.
Rosanna.
I vote yes.
Jan.
This has been very difficult, but according to my beliefs, I have to vote no.
Thank you. Dr. Faywell.
No.
Great, thank you. So the motion carries 4-2. And that leaves our last item of business, which is adjournment. Do I have a motion to adjourn?
So moved.
Is there a second?
Second.
Great, thank you. All in favor, say aye.
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 Anybody opposed? Thank you. Have a joyous, peaceful, and a healthy holiday, and we will see you next year. Thank you again.
Merry Christmas.
Merry Christmas.
Thanks again. Bye, everyone.